Okay, good afternoon and welcome to the Westport Board of Health meeting for July 22nd, 2024. I'm calling this meeting to order with the announcement that under Mass General Law, Chapter 30A, Section 20F, this meeting is being recorded. Please join me in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, we'll get right down to business. We have a written report from Matt, and you have a question?
Well, I just wrote wow for 250 wildlife issues.
I think that's a typo.
Is that a typo?
I'm sure it's 25.
I'm sure it's 25 in a 2-week period. I know he's busy, but I'll have to ask him about that.
Okay, so we'll get that. But I was like 250. There's not enough hours in the day to tackle that. And that was the only question I had on the written report.
Okay. And why don't you turn to your verbal report, your update, please?
Sure. So just a reminder, annual transfer station stickers are required as of July 1st, or were required as of July 1st. Stickers are on sale at the transfer station and Board of Health office. And just another reminder that transfer station only accept checks or money order. On July 8th, the MOU for the Scouts was approved and signed by the Select Board and the Board of Health. The work on Lot 3 is scheduled to begin on August 1st and should be completed by the middle of August, roughly around the 15th of the month. Once the lot is ready, the Scouts will get the green light to move in. In addition to the Scouts moving into Lot 3, the bike recycling program will also be moving from their current location behind the glass container to Lot 3. Lot 3 will provide a safer space as well as provide more space for both parties to operate. The transfer station is seeing an increase in the amount of recycling that is taken in. As a result, we had to order an additional cardboard container. Plastic recycling has also picked up a great deal, and right now I'm assessing to see if we need to order another container to handle the increase. The staffing situation at the transfer station continues to be a challenge. We are down one person who is on extended leave. Right now we are working with a temp agency to fill the void. And we have temporarily filled the void with a third person at the moment. But the Board of Health agents John Swartz and Joel Reese have recently filled in at the transfer station so that we can keep the gates open to the public. I mean, we do have to operate with a minimum of 2 people. And if it wasn't for John and Joe filling in those days to cover, we wouldn't be able to have open. So I want to say thank you to Joe and John. The Public Health Nurse offers weekly blood pressure clinic on Wednesdays from 8:30 to 11:30. Clinics are held in the nurse's office located on the first floor of the Town Hall Annex building at 856 Main Road. Blood drives have been scheduled for the summer. They will be held at White's of Westport from 2 p.m. to 7 p.m. on August 29th and September 19th. We did have a drive there last week. I think it was on the 17th or 18th of the month. We had 31 donors, which is a good turnout. So thank you for all that came out for that. Animal Control, Tanya and I met with the Personnel Board on the 16th to discuss the second part-time Animal Control Officer and get approval of an hourly rate at $25 an hour for the position. The Personnel Board voted in favor as well as for increasing our current ACO hourly 25 cents higher than the incoming part-time ACO. So basically, our current ACO is being paid $23.04 an hour. The incoming ACO would start at $25 an hour, and we're proposing to raise the current ACO to $25.25. Based on a recent wage study commissioned by the town, the ACO position is currently below the salary range of the comparable communities. I think it's important to know that the Personnel Board approved both requests for the part-time and the salary increase for Nick unanimously. And just for everybody's information, the certificate of compliance was not issued for the new middle high school at the time of its opening because we did not receive an as-built. However, we just received one in June of 2024. Because it was done well after the fact, when it should have been done, the system was backfilled. The as-built does not show the elevation and grades for the pipes in the field. Therefore, the as-built does not meet Title V requirements, which Title V states in part. Prior to the issuance of the certificate of compliance, the disposal system installer and designer shall certify in writing that the system has been constructed in compliance with 310 CMR 15, which is Title V. The as-built plan shall be prepared in accordance with 310 CMR 15-220, and that a minimum shall reflect any changes that approved design plans and show the exact location and elevation of all system components. So I do have that as-built. It doesn't show the exact location and elevation of all system components because the system was backfilled when they went out to do the as-built.
So we have to wait for plans that show.
Well, the system's backfilled, so what they did was they copied the elevations exactly the way they were on the septic plan, but there's no way to know if there was any changes, any difference in elevations because the system's backfilled, so we can't get that information. So unless they're going to dig up the system and get the elevations, there's no way to get them.
So what does that mean for us?
It just means we can issue a certificate of compliance, and it is what it is. It's, the town made that decision to move forward, so, but we won't, we'll stay in compliance with Title V, and, as far as I know, it's operating fine, and
And it operates very well, and it's in compliance with, I think, what the planning board had set for the milligrams per liter for the performance of the system. So we see the reports when we get them, and it's well below 10 most of the time. In FY25, the South Coast Public Health Collaborative will be looking to add a full-time community health worker to the grant staff. The intent of the position is to have the person work in the collaborative communities to support, to provide social support, education, and advocate for the health needs of the community, of different communities, individuals and groups. So basically, we want to hire somebody that's going to come in and identify in all of our communities where there may be issues with health equity or racial type equity, inequity, and work with the communities to try to identify those and see what services and what we can do to help with that.
How is that being received by the other communities?
I think it's being received okay. The nurses in the community just want to make sure that we're not hiring a public health nurse to do the same job that they're already doing. And as I explained, this position is not a public health nurse position. It's quite different. It's more like an outreach type position. And so all has scheduled a meeting with the nurses so they can kind of go through the proposed job description, tweak it, talk about their concerns, because the target date to hire somebody is September 1st. So we'd like to get all that job description stuff out of the way, talk with the nurses, make sure that they're good and the other communities are good with this position so we can move forward.
It sounds like, I want to say a nursing assistant, but it's this position is assisting the public health nurses in meeting their goals and initiatives.
I would say, all the public health nurses, I don't know them all, I don't know exactly what they do every day, but I know that they're very busy with what they do. And going out to the community and asking to see where somebody may not have health insurance or somebody may not have services that they need is not typically something they have time to do. And I'm not speaking for all of them, I'm just saying, it's just been my experience that just doesn't happen. So this position would be kind of, I'm gonna go out, because, one, DPH is saying this is a priority. We have to go out and identify these areas in our towns that aren't, up to where they should be with these pockets of people. And we're trying to check that box. The DPH is putting such a big focus on the health and racial inequities in the communities that we don't have a choice, and we run the risk of not being able to keep the grant if we don't start checking some of these
You have to
boxes.
address it.
Yeah.
Okay. Do the boards have anything? You're asking public health nurses for their input, but do the boards themselves have any input into how this position would help meet those inequities or address that issue?
I would expect that the public health nurses would, kind of get through this job description and get it nailed down, and then bring it back to their boards. Would be what I would expect. Or bring it back to their director to bring to the boards to talk about and see how they feel, if they had any input.
It's the same thing.
Westport, Freetown, and Lakeville have begun the digitizing of their Board of Health files. The entire process will take 3 to 5 months, and that's speaking just for Westport. It's going to take 3 to 5 months. We just have that many files. They had the company had come in and taken almost 50 boxes already out, and that's going to take a good couple of months just to get those processed. They'll come in, bring them back, and grab another group of boxes. So, just a lengthy process, but in addition to the digitizing, Westport also purchased, through the PHE grant, the DocuWare software. The software is a cloud-based system that will store and catalog all the files, and the plan is to require all submissions for septic-related work be submitted digitally in the future, so we can easily upload these files to the DocuWare system.
I have a big question.
Yes.
What are we going to do with all those file cabinets?
Yeah, I'm sure somebody will use them.
If anybody's come up to the Board of Health office, you see all these file cabinets with all the data and the information about septic systems and home and all of that, and there's quite a few.
There is, but I think this will be great for us. We'll be more efficient, and eventually, my goal is to have the Board of Health be electronic, and packets will no longer be like this. You'll have a tablet of some sort, and either the packet will be uploaded to the tablet when you go up and get it, or you'll have to go into a cloud and pull the packet out. I would say within a 3 to 4 month time frame, I would expect we'll be doing that. Which was my next point to talk about. So.
Okay.
Director approved plans, so just get to these. All right, so we have some director approved plans. We have a 3-bedroom repair at 268 Sanford Road for Robert Jalbert. Using a Presby system. This has been through Concom already, and it does replace a cesspool, and it will need to be deed restricted to 3 bedrooms because it's on a 22,671 square foot plot. We also have a 3-bedroom repair at 53A Cummings Lane on a 34,476 square foot lot for Mary Ann Kapinski, utilizing a Quick 4. It is replacing a cesspool. It's been through Concom, and this will also be deed restricted.
That much for 34,000.
Well, in order for them to go to 4 bedrooms, they would need 40,000 square foot.
Okay.
Oh, they're going to 4 bedrooms?
No. They're at 3 bedrooms, but Don asked, I think, why it needs to be deed restricted, and because it's only a 34,000 square foot lot.
Okay,
If they wanted to go to 4 bedrooms, they would need a 40,000 square foot lot.
okay,
Got it, yeah.
gotcha.
I mean, they could always remove the deed restriction and do D-night, and I believe a 34,000 square foot lot with D-night would get them a 4 bedroom.
Mhm, okay.
Um,
It is right close to the river, but, it's what it is. It's there are no wells within 100 feet, right, so.
Okay, we have another 3-bedroom repair for 32 Almada Street on a 21,380 square foot lot for Kevin and Keith Tony. This is gonna be utilizing a Presby system. It's still pending Concom review, at least at the time we typed up this list. And it will need to be deed restricted as well.
Is this one that Joe did a bed in cabin?
Yeah.
Okay, I'm just confirming.
And we have a 2-bedroom repair at 51 Faulkner Street on a 65,688 square foot lot for Louis Maderos, utilizing the Presby system. This has been through Concom, and this is another one replacing the cesspool, and will also need to be deed restricted.
Okay. So I move that we endorse the director-approved plans with, I'm going to go down the list here, but with the 268 Sanford Road with a 3-bedroom deed restriction, 53A Cummings Lane with a 3-bedroom deed restriction, 32 Almeida Street with a 3-bedroom deed restriction and Concom approval, and 51 Faulkner Street with a 2-bedroom deed restriction.
Second? All in favor?
Aye.
That's unanimous, thank you.
I just wanted to add that our 450 appointment was postponed to the August 5th, so they will no longer be coming in town.
Okay, we'll move on to the minutes. Are they July 8th or July 12th? One says one thing, one says another. What's the correct date?
July 8th?
Okay, it was just the agendas. Let's take it.
Yeah, the agenda had a couple of things on it that were not accurate with numbers. So.
Okay, any questions or concerns about these?
I don't think so. Did you? Do you think Mr. Fell does?
I think we're fine. It'll be innocuous.
All right, so I move that we approve the minutes for July 8th, 2024.
Second? All in favor?
Aye.
That's unanimous, thank you. 4-2. Okay. Moving on to other business, we have a request from Spindle Rock Beach Club with a sampling variance application, including a sanitary survey. They would like to return to monthly testing. Right now they're doing weekly because they had fallen out of compliance with one test result a couple of years ago. Matt, your recommendation?
Yes, the sanitary survey looked fine. So this was before us, maybe a meeting or two ago. They were requesting a variance of the weekly testing because they had an exceedance a while back. DPH sent it back saying they wanted the sanitary survey done, and the board would have to vote to accept the survey and vote to, again, to put in one monthly testing. And then what we do after that is send it back to DPH, and they have the final decision.
I have a question about this. Page 4 of 20 on the sanitary survey. Is it they're only testing during the summer months?
Yeah, when the beach is open.
Okay, all right, because I was looking at the number of samples and if they were supposed to do weekly versus monthly, so, okay, that explains that to me then. All right. So I don't have any other questions.
Okay.
Okay, so I move that we approve the request variance to test Q month instead of, was it Q weekly testing? For Spindle Rock Beach Club.
And accept the sanitary.
And accept the sanitary survey.
I will second that. All in favor?
Aye.
Aye, that's unanimous. Thank you. Resubmit to DPH. Okay, board member updates.
No, but I just sent a draft of the next lines regarding vector-borne diseases, and I hopefully will get that in the shorelines for the next, this coming Friday. If I can get it in for this coming Friday, but more likely for the following Friday.
Okay.
Thursday, Friday. And I haven't done anything yet with organizing around the both the items that you had asked me to do, was to do the composting, looking at that. So I will start to look at that, and I will start to organize around. And I don't know how, I'm blocking now. I don't know how we're doing with my spending time with Olive to talk about because that's what I'm kind of waiting for, Olive to be available so that we can problem solve and do some planning around a task force to address the opioid settlement funds. So I know she's got stuff.
Action there, though, right?
They haven't taken action, but I thought that as a Board of Health, we could do not necessarily a task force, but have a focus group to ask people in the community. Be proactive, and then just say, what do people think? People have been impacted by the opioid crisis. People that are in mental health care here in the area, or health care here in the area, might have some ideas so that we can at least be thinking about presenting some of that to the select board. So, I want to do it with Olive because she, to me, is the expert in this particular area. But I'm waiting for her to be freed up from some of the other responsibilities she has before I approach her.
We can definitely approach her and ask her, but I would just, as far as getting stuff out to the community and asking them, we can send things out by mail or some kind of survey monkey, something like that to get some kind of response to whatever questions you want to ask. But
right, and that's why I want to meet with her to what questions do we specifically want to get feedback from the community. And then there are a couple of people who are interested. I have names of 2 people. When we did the presentation in May for Mental Health Awareness Month, 2 people approached me at the end of the presentation and said if there was any kind of task force, any kind of organization around making decisions or making recommendations, that they wanted to be involved. So I have 2 people's names and phone numbers to contact. And I'd like to be able to contact them at some point to say, this is what we're working on, and we will contact you with a date to meet. So.
yeah, feel free to get with her anytime and schedule something. I just, like you started to allude to, is I'm not sure we're going to get access to any of those funds. So
No, but the Board of Health can make recommendations to the
Yes.
select board.
That's right, and I was clear about that the last meeting, that it's for us to make recommendations to the select board, that it's not our decision, but we can certainly address the proper use or the most effective use of the funds that will impact the greater community. And I think that there's, that as a Board of Health, we can take some leadership on that, especially with some of the public health concerns. We provide in the nursing office, we have Narcan available. That there are some initiatives. Olive is trying to get these stations. She'd like to have stations set up around town with a Narcan. So I think that there's other stuff that we can take a lead on. Doesn't mean that we are going to make the decision about the money that's available and what money will in the future be available, but that we can at least be a leader and present what our concerns are and the concerns of the community. So,
I would disagree. So anytime if you reach out to all of them, yeah, sure.
I think all busy with the year-end
oh
report and
yeah,
all
no,
that.
I heard that from you, Matt, that, there were other things that you wanted to focus on, and, I don't know that there's a rush on this, but I certainly would like to be proactive about this and be able to present before the select board, and once we're organized, go to the select board, get on the agenda and say, here's what we've presented to you for you to use in your decision-making process of how these funds are going to be used. I'm trying to be as diplomatic and as possible with it, but I just think that people in the community really need to have a say.
I agree, and thank you for taking the lead on that. And thanks for that column. I think I'm working on a burial project, but which may come back to the Board of Health Department. But the other thing is probably the August column would make sense. That will be on the new layout of the transfer station to get people acclimated to the Scout bottle and can redemption center moving down to lot 3 and the bike recycling moving and so on. So we'll have some signage anyways.
It would be nice if we could sort of assess interest in the composting at the same time.
Mm-hmm.
Because that's part of the issue, is that it's a nice idea, but how many people really are going to participate? I think that that's a good idea to add to the transfer station, especially with the transfer station right now. We're not manned completely the way we would like it to be, right? So, but I think that it would be maybe a good way to introduce that as an option and get feedback from the community.
And there are other, we have to work on updating the regulations because there's updated standards around what's recyclable and what can't, and the trash and things like that.
And that's not on our agenda for Wednesday though, right? Because we have a
No,
working meeting on
no.
Wednesday.
I'm just saying that that's a future column that I'll work on for August. And I know Phil had talked about doing a column on microplastics. I'm not sure if there was one on PFAS that we can do, but
Didn't we have something on PFAS?
maybe we could. I've just been reading so much about it.
Right.
Seen or heard, written about. Okay. Next, our first hearing is at 4:40 p.m. 4:30 must have canceled out. So we have a few minutes. We have a working meeting on Wednesday at 9 a.m. and then our next regular meeting is August 5th. The working meeting topics will be the proposed tight tank regulation and sort of working on it, getting started on a well regulation. We have some components in existing regulations, but no comprehensive regulation. And water quality, drinking water quality is sort of becoming a more, it's raising its profile as a concern, and we want to make sure that we're doing the best we can to protect drinking water quality and have some good standards around that. So that's Wednesday morning, and that'll be here.
Yeah, it'll be in this room.
It's 9, right?
9 a.m. Do we have any topics for the next regular meeting?
I don't think it's for the next regular meeting, it's the one after. We're going to address the Labor Day holiday because it falls on Monday of our meeting. So that's, I think I have it on the agenda for the 19th to discuss.
Okay. We are also planning to go, I believe, to the select for getting approval to post an assistant animal control officer position on their next meeting, which will be
Not tonight.
August 5th.
not tonight. Yeah, no, I mean August 5th, which will be the 7th.
It's the same day as our meeting.
Oh,
So we'll have to keep that meeting so that we can get to the select board on time. Although the last time we did that, we waited about 2 hours to get to our agenda item. So I don't know. Okay.
and then what's Phil was working on? He's working on that task force, or it's not a task force.
Hazard mitigation.
Hazard mitigation.
Yeah. Anything new on the climate resilience?
No, but I'm thinking one of the shoreline things was, hurricane preparedness, but, no, they did have a meeting, last week, and the focus on the meeting, part of the focus was on the historic areas. And finding ways to mitigate damage on the historic. They really looked like they were focused on the point. But as far as for us on health, no, there's really nothing. There's nothing new. So.
Okay. Well, why don't we, while we're waiting, we can vote to continue the variance hearing for Greg Nicholas for 35 Elmwood Ave. This is for Edward Gouveia, a 3-bedroom repair with an influence rating of 0.4 on an 8,750 square foot lot. That should be continued to August 5th. Do we have a time?
August, it's not a continuance, because he canceled it.
Oh, okay.
So, so I don't have a time yet. I don't, I'll have to let you, I'll let him know,
Okay.
and then I'll email the board, or it'll be on the next agenda.
Okay.
So there's no motion or anything?
Well, it's noticed as a hearing for today, so I think we do need to vote to continue it.
Okay, and he canceled it, so, if you want, I would say, I'll have to email the board.
Continue
with the time.
to August 5th with a time to be determined somewhere between 4:30 and 5, probably.
It's just contingent on whether or not the water tests come back in that amount of time, and, just have to wait and see.
Okay. But for abutters or other interested parties, they can check with the office. For the exact
So moved.
second, all in favor? That's unanimous, okay. All right, we're just waiting for Mr. Potter on our 440. Anything else?
I only have 5 minutes, so it wouldn't be enough time.
No, you have 10 minutes.
That clock is slow. There's a lot going on. We're still wrapping up year end. I'm working on some reports for the transfer station to just, this year, I'll just say briefly that was the best year of all the years that I've been here in terms of direct revenue. So, yes, it's just, that's how busy it's getting over there. And we need to start thinking of a long-term, well, maybe even a short-term solution of expansion and how we're gonna deal with that and what that might look like. So I've started to think about it and, where we would push things out and how we would set them up so it would be easy access for the public to get to these extra containers.
What's our understanding of why there's such an increase?
Curbside pickup is just, well, one, the prices have gone through the roof. Two, I've heard today that 2 of the big, largest curbside pickup companies are no longer accepting new customers. So that's a problem. And those, I think, are the biggest factors. I get,
Population's growing, right?
Yeah.
and I think 3, you can get rid of a lot of things at the transfer station that you can't on curbside pickup. And for some of the things that you can get rid of on curbside pickup, the price is like quadruple of what we charge. So, it makes sense to use the transfer station financially, I think, in a lot of situations.
Do we have, know what the number of people is and how it's grown, like what it was last year versus this year?
I do, but I wouldn't, it's part of the report. I haven't completed the report yet, so you'll see that. And I can show you the increase in dollars and cents, but I also show the number of sticker users from FY23 to 24.
I just think that's important information. So,
Yeah, we'll set up a specific time to have you do a, sort of summary report for the general public.
Yeah, and a lot of it, I'm gonna standstill a little bit because I didn't have a chance to talk to the town accountant today, but I don't think all the expenditures are posted yet, to the year-end expenditure reports, because I need that report to balance out, what we actually spent on direct expenses in FY '24. I could balance it off. Nancy keeps a really good running sheet of our expenses, but I really would like to make sure that our internal sheet coincides with the town accountant sheet.
Okay.
Well, I was glad to also hear that, the move of the bicycles down where the scouts are.
Mhm.
You know, that sort of looks like that's a place to expand, and would that be a place to expand composting?
Well, that's a possibility. The way it's set up in Little Compton, the food composting is right next to the trash, because people typically, they have those little biodegradable bags. But if we're short on space,
Yeah.
it might be
Because you were talking about possibly needing another container.
Right. I was thinking specifically, so where the C&D dumpster is, you drive down, you stop to go down, and you throw things over the wall into the construction debris dumpster. Just very preliminary in my mind. I'm thinking about, I can probably fit 2 or 3 dumpsters, but turn them so they're still going out this way. And, people can get down there, we can have another trash dumpster, we can have another plastic dumpster, and another, a C&D dumpster all in that row. It's convenient and easy for the people to just be able to toss whatever it is into a dumpster over a wall versus climbing up the ladder and putting it in the dumpster. So that's one possibility. The composting area is difficult to put anything in because it's super muddy, and people really, when it gets really muddy, you have a hard time getting it out of there. So we would have to do some substantial upgrade to that area to make it functional for people to go in and out of it on a daily basis.
A concern I would have with the dumpsters stacked the other direction is that people, will dump the plastic in the wrong, they'll miss and they'll dump it in the wrong.
And maybe it's just 2 dumpsters and,
I'll let a big wall in between.
yeah, or something like
That's
that we could do. That's, again, it's easy enough to do, just money-wise is the issue. But anyways, I need more time to think about processing and come up with a plan to present to you guys to figure out what we would do.
Okay. Mr. Potter, we're not going to keep you waiting because we're waiting for you. And there are no butters for this, right?
Yeah, 3 abutters.
Oh, okay.
I have not got the green cards back as a mail now on July 13th.
You expected anybody to come in?
No.
Okay.
And it's called I assume they're called.
Okay, well, we'll go ahead and start if we need to circle back because somebody joins. But we're ready to move on and move on. So let me call the 4:40 p.m. variance hearing. This is it's actually a local upgrade approval. This is Len Potter for representing Pauline Raposa at 95 Sylvia's Lane. This is a 2-bedroom repair with an infiltrator put forward on an 8,750 square foot lot.
10,000
Okay, it might be one of the typos.
It is one of the typos.
Okay, Len Potter here for Pauline. This is a lot down on the lower road at Penny's Heights, and the river is 82 feet away from the front of the house. Currently, there's a cesspool located, as you can see, right off the southwest corner of the lot. And my intent is to take and pick up the sewer pipe from the house, bring it across the front of the house into a 2,000-gallon 2-compartment tank, and then pump this effluent up the hill to the leaching area, the quick force system, which is just 20 feet from the side of the pools. It has to be in 10 feet from the property line. Property line is staked out, so that was a good thing. Then I have 3 wells. I have the owner's, 4 wells. I have the owner's well. That's proposed to be 51 feet from the proposed leach field. I have 99 Sylvia's Lane, and that's going to be 56. Then I have 81B Sylvia's Lane, and that's 52 feet from the leaching field. That one's uphill a little bit. The existing well at 81A Sylvia's Lane is 72 feet from the leach field. Those 2 wells are uphill. The water tests were taken, and I have the results for 99, for 95, I don't know, and from 72, I'm sorry, 81A Sylvia's Lane. 81B, the lady passed away. That now belongs to the 2 sisters. One's in Maryland, I believe, and one's in Texas. And no one's been in the house. But Mrs. Raposa said that if she talked to them, but the house is closed, so they're not using water.
Yeah, right.
So I can't get in the house. But the 3 wells that were tested with low nitrates.
Mhm.
That's the key. So the variances that we're asking for is the proposed septic tank is less than 10 feet from the crawl space. I'm trying to keep it 10 feet from the property line. And the distance is 25 feet. The proposed system is less than 100 feet from the owner's well and the 3 abutting wells, which I've already mentioned. And that's pretty much it. The system itself, the cesspool virtually is probably 82 feet away from the river. The new leaching field is going to be up approximately, let's see, 82, it's going to be 46. It's probably going to be somewhere around 95 feet or so, or more than that, 82 plus the 70, 150 feet from the river.
Mhm.
So that's pretty much all I have to offer.
It's definitely an improvement. Of course, being right next to the river, I would, in an ideal world, like D-Night, but you have, with the maximum feasible compliance, the well test results don't indicate any level of concern because they're all below 5. I'm sorry, I should jump the gun. I should turn first to Matt's report.
Is the entire property is in the velocity zone, flood zone?
The velocity zone is, let me see.
I can see the VE zone down here, elevation 16, but it's going this way. So up here, it's just within the riverfront area, but it doesn't look like it's in a, at least I can't see on here where it would be in the flood.
No, it's not, the system itself is not. There's the flood zone VE 16,
Yeah,
which is right at the rear of the main portion of the house, not the
Okay.
patio.
Right.
So we're not in the velocity zone. The tank's in the velocity.
yeah.
So I need that waiver to leave the tank in the ground as opposed to raising it up to 16 feet.
Other than that, though, everything is, I mean, it's the best thing that can be done, so.
Okay. Questions, Don?
No, I don't have any. I was just wanted to see the abutter notifications to make sure that the abutters were notified.
Problem you have this time of year, the summer cottages, and the people, I can mail them to the addresses that the assessors have, and they're not there. I just got 2 back for Atlantic Avenue, we did like 2 meetings ago.
Yes, we can do.
Okay,
Legal obligation is fulfilled.
that's right. All right, so I move that we approve the plans for 95 Sylvia's Lane, owned by Pauline Raposa, dated 6/5/24. With the following variances, or I should say variances as written in the plan, but for tank setback to the crawl space of less than 10 feet, the proposed is 5. Distance is less than 100 feet. 99 Sylvia Lane is 56 feet. 81A is 72 feet. 81B is 52 feet. And 95 Sylvia Lane is 51 feet. and that to place the tank in the flood zone. And the following conditions: 2-bedroom deed restriction, hold harmless, Concom review, and 3 years of water testing for the 4 lots.
A second. All in favor? Aye. Did I hear you say aye?
I did say, oh, aye.
Aye. That's unanimous or 2-0. So, all set. Thank you, Mr.
Okay,
Clark.
thank you. See you next time.
How was the fair?
Very nice,
Oh, good.
very nice. I didn't get many complaints, so that's a good thing.
Well, you know, we lived directly across the river from the fair. We used to hear it all the time, but I think the vegetation has grown up so much and you maybe don't go so late.
We don't go so late,
Yeah.
so we try to put the quiet tractors on,
Great, thank you.
You wouldn't after 50 years.
And you hope you do.
Yeah. Well, it's still ain't perfect.
Okay. I would take a motion.
Okay, so being there no further business, I move that we adjourn this meeting at 4:47 PM.
Second. All in favor?
Aye.
Aye. It's unanimous. Thank you. Thank you, John. Thank you.